The Theology, Medicine, and Culture Initiative has been hosting a series of conversations about COVID-19 with faculty and alumni. In this clip, TMC co-director Farr Curlin talks with Luke Bretherton and Patrick Smith, Christian ethicists on faculty at Duke Divinity School.
I just want to say this topic is one that, at least if you wear a bioethics hat, has been everywhere. The question of how are we going to act when we don't have enough ventilators for all the people who have clinical indications otherwise for ventilators. Before we turn to Christian tradition, what do you two take to be the key ethical questions or issues at stake in how we triage, allocate, or reallocate medical resources?
I think that, obviously that's the presenting issue. I do think there's part of a kind of Christian approach. It impels us in a sense to take a step back. And I think there is some prior questions to ask around, is the primary issue one of cure or one of care? And so in the Christian tradition, there's always been a priority of care. The refusal to prioritize cure has angered a lot of people. Famously, the example of Mother Teresa, Christopher Hitchens, if you remember, you probably don't, all you guys are too young, but he has a famous expose of Mother Teresa, and kind of people used to get very upset with her for not instituting forms of cure for the poor in India and Calcutta. And her argument, which I think in keeping with the Christian tradition, was there's always a priority of care where resources are scarce, or do we always have this imperative to cure? And so I think there is a question here about how we frame, do we always accept the presenting issue, which is one of scarcity and technological responses, ventilators and questions of economies of scarcity, or can we step back from that presenting issue and reframe it? And what happens if we imagine and narrate this as a problem of care, rather than always thinking, how do we meet the demand for cure? And so I do think there's some kind of reframing issues that have to go on here. If we think about it as a problem of care, we've got a whole rich tradition, and very specifically in response to pandemics and the emergence of institutions and the kind of place of Christians staying in cities, in relation to the Justinian pandemic and others, and direct theological reflection on the church responding to pandemics in a variety of scenarios. And there the issue of the kind of moral issues are not so much technical ones of will I have the right technological tools to cure, but will I, which is then about which tools are available, but rather will I have the relational capacity to care? And that's the question of virtue. That's the question of the strength of my commitment to Christ. And do I have the patience, endurance, courage, hope to be present to people in their hour of need at risk to myself? And that's a very different kind of set of questions of which there's a very rich resource.
So Patrick, Luke is taking us outside of the terms of the debate as they're presented to a different framing. What do you make of how the world of bioethics, as you observe it in the last month, is assessing this problem? How do you see it assessing this question, this problem, and what do you think are kind of maybe the strengths and the shortcomings of that?
Yeah, actually, I think the assessment is, it's a mixed bag. In many ways, some may disagree with this, but I think there are a lot of people and organizations and committees who are trying to do the best that they can, right? They're trying to anticipate some of these issues that they're facing, trying to provide support for their clinical staff. Sometimes the pass that they make at this may have some holes or some gaps that once it is presented in some ways for some type of public conversation or critical analysis, and they come back. Just one quick example with some of the folks in the Boston medical community who are trying to work on particular protocols for, how to handle this issue of allocation of ventilators if the crisis moment were to arise. Spent a lot of time, work, energy, effort, presented it to some other groups. There were some blind spots, as we would expect, right? That pushed back to kind of revise some of this. So I think it's a mixed bag. Some of the protocols, like say in issues of in places in Alabama, right, where they were saying that you can discriminate along the lines of maybe age or some type of mental disability and so on and so forth, right? Deep concerns, right, and problems about that. Other areas, I think, are doing a better job. So I think it's mixed. And those organizations, institutions, people and committees, task force, one of the areas that I am grateful to hear that people are trying their best to think about is to take seriously the existing kind of healthcare disparities and trying to figure out, are there ways that we can do this that can minimize the widening of that gap? And that is much easier said than done, as many of you can imagine in a space like this. And so while, again, it's mixed, I am appreciative at least some of those questions are being asked in trying to develop some of these protocols and engaging ways forward. There is this larger conversation, I think, about the social determinants of health that are always there, they're always present. And the challenge often is that, when many of us are emphasizing this, the pushback as Luke is raising is that, well, we need a solution right now. Here's the problem that we're in right now. And so on one hand, yes, there's something that, yes, we must do, but whatever pathway forward we are trying to develop, we can't do it with, as Luke would say, blinders to the larger kinds of issues that got us to this particular place, right? And in many ways, some will say, well, we can't address social justice issues at the bedside, right? We've got to deal with things at the bedside. While on one hand, I think I agree with that, but I also think that we can develop and think about policies and procedures and a way forward at the bedside that takes into full consideration this kind of larger scope and framework, especially as those of us who are Christians, our moral imagination is informed by a broader set of values and resources.